So my name is Babashola Fateh, and my background. I'm from Nigeria. I'm Yoruba, but within the Yoruba tribe, I am Ekiti. Within the Ekiti, I'm from a very, very, very small village, but very, very special place called Ifishin Ekiti, in Ekiti State in southwest Nigeria. Yeah, I went to pharmacy school. So again, my dad is a physician. He wanted me to be a doctor, like most parents. But I knew my place was outside. Like I just knew. So we kind of consensus was, okay, you know what? I'm not going to do medicine. Okay, I'll do pharmacy. Is that okay? And I did pharmacy, and so that's kind of how. But when I was in pharmacy, in my 4th year in pharmacy school, I saw this professor who did research, and I'm like, yeah, that's where I want to be. And I did research right from Nigeria, published a lot of the work even as an undergrad. I was extremely fortunate, and by the time I finished, I was in first year of grad school in Nigeria. I was representing my professor at meetings of the Ministry of Health, like kind of with like the Secretary of State type meetings, because he was so busy and was such a big person, and so I was the person who was doing the work. So he had no choice but to send me, and I was going all over the globe right from Nigeria. And so for me, a lot of my identity, my work ethic, my view of preventive approaches to community building came from that, and also came from the experience of my father as a community builder in Nigeria. So I did pharmacy, but right from then I kind of immediately began to lean into public health and public policy and things like that. Of course, I still maintain my roots in research, in scientific research, and then I did my master's. And one of the things I just want to put this out there, a lot of people want to do masters. My philosophy about things like that is what? Guess what? You typically only go there to meet one person. And I met that one person, and that was it. I didn't care about anything else. And that was the person who mentored me, who showed me the ropes. And so that was my story in terms of my education. And then when I was there, I wanted to go to grad school, and I got one other mentor of mine kind of suggested a school, as and applied, and the rest is history. So I want to say the summary of all of that is I am the product of a lot of grace and a lot of benevolence from people. And I want to say that as somebody who mentors people now, what they gave me wasn't money, but what they gave me was way more than money. And that's one thing I appreciate about the African culture. It's we give what we have, and we give ourselves to open doors for others. So that's my story, I have to say. So yeah, so let me tell you what the project was. Forget about the title of a degree. So at the time, the country was trying to test new drugs for malaria. Malaria was and still is the #1 killer of children in sub-Saharan Africa. And so the lab I was in, was a testing zone for the Federal Ministry of Health and the collaboration with the World Health Organization. And so we're testing malaria drugs to see what should be the national policy. And so I was a research assistant on that project, and that project also became my master's project. So again, pharmacology is the study of drugs, how drugs work. And so I studied malaria drugs pretty much. And that's the context where I began to attend Federal Ministry of Health meetings, attend international meetings with World Health Organization and things like that. But so that's kind of that. And I met one person. The person mentored me. I did what I wanted to do, and that's it. Ethic. If you were working with sick children in drug studies, you did not have a time in or time out. We worked Mondays through Mondays, 8 a.m. till when the last child leaves, whether that's 10 p.m., and you still have to take the child home. And so he taught me work ethic. The other thing he taught me is he taught me the value of scholarship. He was devoted to his scholarship, man. At the time he had like over 100 papers, and so he made me realize the value of documenting things. And one opportunity that he gave me that I'm eternally grateful for is, you see, talking about mentorship, many people want to mentor I'm going to show you how I do it so that you can do exactly what I do. Well, you're only making a technician. You're not making somebody who can think of their own. You're not allowing the person's creativity to come out. So one of the things my prof did to me was, because I worked till late and I had no other thing to do, I had the keys to the lab. I could go into the lab, and this was the day when internet was not a common thing, so I could use the internet, one. And two was I had access to lab records. Lab records, written records, also specimen records. I had nothing else to do. I just delved into those records, and I found something new, even as a master's student, that complemented a lot of the work that they were doing, and was really, really meaningful. Like, I would call that my first discovery, because I did not discover that because he told me to do that. I discovered that because I was put in a sandbox, and I went to play with the microscopes and things like that, and I made my own discovery, and I was super proud of it. And so what this mentor gave me is, he gave me a sandbox. He didn't tell me I did the things he wanted me to do, but he did not stop me from doing the things I wanted to do. And for that I am eternally grateful, because that's where I began to cut my teeth as somebody who is inquisitive and who wants to learn on my own terms. Okay, on my own terms. So yeah, that's the biggest gift he gave me. And one other thing he gave me, my first international trip, he paid for it. I went to the UK for some training, and he paid for it completely. And it was my first time, so it was meaningful to me at the time as a fresh graduate student.